Hello everyone, and welcome to SCNM's webinar. We're very excited to bring you this interactive online experience that will let you learn more about a naturopathic perspective to treating thyroid disease, presented by a Phoenix top doc, Dr. Alan Christianson. My name is Jody Durham, and I will be your host for today's webinar. During this webinar, you will be hearing from one of SCNM's first alumni, Dr. Alan Christianson, who authored a book about thyroid disease, The Complete Idiot's Guide to Thyroid Disease. I know some of you have had the chance to read the book prior to this webinar, but even if you haven't, you will find the information presented today to be very informative. So once again, thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me introduce Dr. Christianson. Dr. Christianson's lifelong interest in the healing power of nature was sparked as a child in rural Minnesota. After struggling with health challenges, including epilepsy and obesity, he realized early on that his diet had a profound effect on his health. His fascination with plants, science, and their correlation to healing, and his quest for knowledge continues to provide inspiration. He completed his pre-medical studies and studied nursing at the University of North Dakota in Grand Forks. After that, he went on to study naturopathic medicine at SCNM, where he was a member of the first graduating class. Dr. Christianson specializes in endocrinology and pain management. Dr. Christianson, a 2011 Phoenix Magazine Top Doc recipient and co-author of The Complete Idiot's Guide to Thyroid Disease, founded Integrative Health in 1997. He resides in Scottsdale, Arizona, with his wife Corinne, their 2 children, and his 6 unicycles. So with that, let me switch this over to Dr. Christianson.
So here we are, and I understand that many of you all are prospective students and looking into the school and looking into the profession. I really want to commend you on your choice and commend you on your consideration. I think it's obviously I think that's a brilliant direction to go, and so much potential to make a big difference on individuals' health and also the health of our world. We're really at a crisis point, which we'll talk about later on with our global health system. Quick thing about my backstory. Jody mentioned briefly in the intro about my early health struggles. Yeah, I was actually born with brain damage. My birth mother had very, very poor health, and I came out badly from that. And the odd thing is that I had 0 motor skills. I couldn't really play sports or do physical things, but I was a very, very early reader, and I actually completed an adult encyclopedia set before kindergarten. So it worked good in some ways and badly in other ways. Somewhere about age 6, I became a real sugar addict. You know, I have a clear, vivid memory of walking along in this one area near a resort that we worked at, and I had a handful of chocolate chip cookies, and I realized that I could completely induce an emotional state, a high type state, from these cookies, and that was pretty cool. It got me out of the funk of being a sedentary, fat, nerdy kid, and so I used that trick quite a bit, and kind of hit the worst of that by age 12, and that would have been 7th grade gym. I've got a very vivid memory of trying to play football one time, running out towards the field where the game was, and even just that much, blacking out, completely passing out. And then we had these gym outfits we had to wear. Some of you all may have had those, and I was pretty mortified. Mine didn't fit properly. I was pretty big, and they didn't have the XXL that might have draped a little bit better. And one of the kids in gym pointed out that of everyone in the area, in the gymnasium, both boys and girls, adolescent, early body changes, that I had the biggest set of boobs in there. And yeah, that totally crushed me and totally left me just infuriated and frustrated. And thankfully, some part of it motivated me too. It wasn't just a complete devastation. And I did what I knew I could do, and I went to the library. And I got all the books I could find on nutrition, fitness, wellness, medicine, and I, quite literally digested them all and started applying it. In the next couple of years, I went back and tried out for the football team, not just playing football in PE, and I became one of the top athletes in my high school. We would do running, and I was the best runner in our training group. So it was this huge change, and I came to realize that our health is something that we really had control over. It took discipline, it took effort, and it took the right steps. It took proper leverage, but I realized that we could radically transform our health. And part of what inspired me too was the realization that doctors didn't really give you that, didn't really know what to do or wouldn't tell you what to do. I had seen doctors growing up, and my weight was a huge problem. I was never really given any helpful advice or any direction on that or any ways to regain my coordination. I figured it out for myself. So I realized there's a whole lot of useful data out there that can help people, and a whole lot of folks that need that data need to know how to apply it. So I planned on going to medical school and then tying in more of these things afterwards to it. And as I got closer to that, I came to realize that even if you have training and good intentions, you've got a very rigid standard of practice to adhere to if you have a conventional medical degree. And I was pretty disillusioned realizing that I couldn't practice nutritional medicine and wellness with a medical degree the way I wanted to. And that was exactly the time I learned about the Naturopathic program. And that was just the perfect fit for me. It was so obviously where I was meant to go. And also at that same time, there was a brand new school opening up in Arizona. And that was just right. It couldn't have been a better fit. And I was very happy to be in that first class. It was a very, very unique experience. And since in the school, it's completely grown and blossomed under Dr. Mittman's direction especially. So yeah, it's a great, great situation right now. So how does this tie to thyroid disease? Well, I finished up and I started practicing right away. I had to pay for my food, and it wasn't a hobby. It was really a profession for me. And I already had a strong interest in thyroid disease. About the time of this that I had been in school, the work from authors like Rhoda Barnes were pretty new. Dr. Dennis Wilson had some thyroid ideas that were pretty revolutionary. And these people were basically saying that thyroid disease could affect people, and the current method of diagnosing and treating it really fell short and left a lot of people undiagnosed and untreated. So I realized there was more to it than just what we learned from the conventional end. At the same time, I saw that some of these approaches that really could treat most anyone with most any symptom with high-dose thyroid treatments weren't really safe and didn't have enough selectivity. So I wanted to figure out, okay, how could this properly be applied? Who does this really apply to, but who does it not apply to, and when are they at adequate dosing? So a real classic case that someone I still stay in contact with was a gal I'm going to call Jamie here. And one of my very first patients, was only about a month or so into practice, and she was 16 at the time, and she was on medical disability. The main diagnosis was fibromyalgia, but she really did not feel well, and that was the closest blanket diagnosis. But she had a lot of issues. She was very depressed, horribly fatigued. Her weight had really shot up. Her hair was thinning, and these were changes that had taken place over the last year or so. Prior to then, she was active in sports, active in a lot of extramural programs in school, and just a really normal kid having a good teenage life and a good early high school experience. And then this totally shifted. And at some point, her mother suspected thyroid disease because there was a very strong family history, including her mother as well. Some conventional doctors did test her and said, no, she has no thyroid problems. They did see some alternative doctors, and they put her on thyroid treatment, which by my later evaluation of the situation was rather aggressive and rather inappropriate, and it created side effects. So right away she stopped treatment. So there's always kind of this background idea that perhaps it could have been it, but it really didn't seem to help when it was addressed. So as I started working with her, it became obvious that she really did have thyroid disease. I saw that she did have Hashimoto's. She had an immune attack against her thyroid, and that was confirmed by ultrasound and also by antibody tests. So we put her on treatment, and very, very gentle dosing, also managing her adrenal function and her health in other ways. She managed to tolerate it fine and achieve good, ideal thyroid function. And with that, in the course of just a few months, she saw very substantial weight loss. She got back to school, got back to her band activities, was able to go on to prom, which is really cool. And I still keep in touch and still monitor her dosing about once a year. And since then, she's gotten to college. She's got a family going of her own. She's actually still an active competitive athlete in several ways. She does local 10Ks and some sprint triathlons here and there. And where she was headed was a really bad direction. And likely, there would have been a point perhaps within 5 years of when she was at 16 to where the thyroid disease would have been apparent enough to where most any doctor would have diagnosed it and at least given her some degree of treatment. And that may not have helped completely, But by that point, had she gained much more weight, it would not have been very plausible to have had much of it come off. And she was also teetering on diabetes. So a lot of these things may not have been reversible had it been caught further along. So her story is really classic, and there's so many folks like her out there that have early thyroid disease and yet aren't going to get treatment by the current guidelines. So a little about thyroid disease in general. It's a huge thing. These numbers are probably very conservative. The most conservative estimates argue that it affects about 10% of American adults, and that's the 27 million comes from. There are many that argue that if the guidelines were broad enough to catch it at earlier stages, it would probably be closer to 20% of the American adult population. Now, there was a large survey done by a thyroid advocate, a friend. She's a wonderful woman, Mary Showman, and she surveyed several thousand people who follow her and asked those of whom who were on treatment how many had persistent symptoms. You know, how many people that had certain symptoms at the time of diagnosis still had those symptoms remaining even after being on treatment for a while. And from doing that survey, she found that that number was roughly half or more, that more than half of people who have been diagnosed and have treated still haven't gotten to complete success in their symptoms. So if you lump together those that have it with those that haven't been diagnosed and those that haven't gotten to be fully treated, that's a lot of people. That would be upwards of 40 to 50 million based upon very realistic estimates. And it's hard to have perspective on just how prevalent that is. You know, we have these marches for diseases, and it's awesome. It's great to create awareness, and we have, you know, runs and fundraisers, but all those diseases just pale in comparison to the frequency of thyroid disease. It's huge. You know, and thyroid cancer even is now the fastest increasing type of cancer in North America. It goes up 6% per year, whereas every other major cancer has been diminishing several percent per year. So thyroid disease is huge. I always call it the Rodney Dangerfield of medicine. It's this big thing that does not get enough respect and not enough attention. And we'll talk about this being driven by autoimmune reactions, and basically because of that, women get it much more commonly than men do. Women are more apt to get autoimmune disease in general, but between 5 to 8 times more women than men have thyroid disease. And throughout the span of a life, at least a quarter of women will develop more overt versions of hypothyroidism. By the more stringent guidelines, perhaps 30 to 40% may develop some stage of it. And yeah, this exceeds diabetes, heart disease, or cancer, so it's extremely prevalent and just far too undiagnosed and untreated. So what is the thyroid? So a bunch of you all got my book, and you would have that question answered. But it's pretty fascinating. It's this little lump of tissue right around the front of the neck, and it's not very large, about the mass of a deck of cards in terms of gram weight, and about that same total size in terms of three-dimensional size, obviously a slightly different shape. The name comes from the Greek word for shield. And the thing that's always just fascinated me about this is the tiny, tiny physical mass of the gland, but also of the hormone the gland releases, and yet how huge the effects of this hormone are. If you could take all the hormone your gland made in the course of a day and put it all by itself in the palm of your hand, you could barely see it with a magnifying glass. It would be about a tenth of a grain of salt in terms of physical mass. And yet, if that tenth of a grain of salt wasn't there, you would have no more than a matter of 2 weeks before you would go into a coma and literally choke on your body's own fluids. We call that a myxedema coma, and that's a fatal condition. And now with that tenth of a grain of salt, say that was maybe 2 grains of salt, that would give you maybe a couple of weeks before your heart would give out. That's called a thyrotoxic storm. So if changes that small can be life or death, you can just imagine what the most subtle changes, how big those effects have upon quality of life. You know, if a tiny bit of a speck extra or too little would do you in, then even smaller fluctuations would certainly make you feel lousy. And this has so many roles that it plays in the body. Basically, every cell in the body is kind of like a small living thing, like a miniature organism almost. And the cells, everything they do is affected by their rate of metabolism. You know, how quickly they convert fuel into ATP and how quickly they synthesize proteins. So the main variable that controls that rate of metabolism within the cells and protein synthesis by the cells is the level of thyroid hormone. And that's basically how we burn our main fuels in the body. So when that's not there, we're not burning fuel. And the double-sided negative about that is, well, you're not getting fuel, so you're tired. You know, your brain won't function properly. There's an old word called cretin. Some of you may have heard that. It's kind of a dated way of calling somebody a dummy. You don't hear it too much. It's actually a medical term. It's a medical term from the distant past when there were areas of people that had so little iodine that they had a very different physical appearance, and they were called cretins. Some have argued that what we thought had been remnants of Neanderthals may have actually been areas where cretinism was endemic, because people look that structurally different when they have cretinism, and that comes on from a severe lack of thyroid hormone. So that lack of hormone has huge detrimental effects upon how the brain develops. When it comes on later in life, of course, the effects are not that physically pronounced on the outside, but on the inside, as far as how your brain works, affecting your mood and your mental focus, it's huge, it's very big. So if there's not enough energy, your brain is lacking in fuel. Also, if there's not enough energy, your body's lacking in fuel, so you're physically tired. And if you're not properly burning your fuel, then it's got to go somewhere, right? So you make it into fat. You store more fuel than you would normally burn when the thyroid hormones are lacking. The biggest amount of calories we burn in the course of a day is calories that are used to keep the body warm, to regulate the body temperature. The amount that we burn from dedicated physical activity like exercise, it's important and it's so helpful, but it's actually much smaller. You know, in most cases, you really don't put out more than a few hundred calories per hour of exercise. I know the charts and the machines and the heart rate monitors may say more than that, but they're a little bit over generous for reasons that I could go into at another time. In reality, we put out very little. And yet, keeping the body warm for most adults, that can be close to 2,000 calories. So it's oftentimes 10 times more than we burn from exercise. And if the thyroid hormones aren't working properly, that could be suppressed by 30 to 40%. So you run the math, and that could be 800 calories per day that you're not burning because of the thyroid not working right. And that's a lot. If you did nothing different, if you had the same diet and exercise levels that worked fine for you for years, but suddenly you were burning 800 less calories per day, you know, about 3,500 calories, that's a pound of fat. So very easily, that's a pound of fat per week that you're going to gain without doing anything wrong by being on a perfectly healthy diet and lifestyle. And that's a pretty tough thing to overcome. Now, of course, if you could heroically train an extra 800 calories and or eat fewer 800 calories, you know, some combination of that difference, you could break even. But remember, you're lacking fuel. So you certainly aren't motivated to train hard. You're certainly not going to want to do hard exercise because you're really tired. And then also, because of that fatigue, people often reach towards more quick burning, high-calorie foods just to give them a bit of a boost. You know, they want to get a brief sugar rush so they can have at least enough energy to function for brief periods of time. And of course, that's not conducive to their health, but that's commonly a strategy people end up going for when they're just that terribly tired. So you put all that together, and that's a huge, huge factor for weight gain. And of course, body temperature will run lower too. Many have argued that body temperature is very diagnostic for thyroid disease. I strongly disagree with that. It does tend to run lower, but there's so much normal range in body temperature and so many other things that affect body temperature, it's not an accurate means to evaluate thyroid status. And also some of the numbers that many have put out as far as being normal are probably a lot higher than typical. So using body temperature alone, you would probably think everyone in the world had thyroid disease. And also the thyroid levels don't really cause a change in temperature by themselves unless they reach dangerously high doses. So your thyroid also has a big role in affecting the growth of our hair, skin, and nails, our connective tissues. So when it's lacking, very commonly people have dry skin, thinning hair, nails are more brittle, crack more easily, and those are very typical. Other connective tissues can also be affected, leading to easier tendon or ligament injuries and easier soft tissue injuries. This also regulates the immune function. People are more apt to have autoimmune reactions. They're also more apt to have allergic type reactions when they have thyroid disease. And they also can have more vulnerability to picking up airborne infections from the environment, so this can impact them that way as well. It does also have roles to play with the ovaries and the adrenals. And ovarian hormones affect the thyroid, and the thyroid affects ovarian hormones. So consequently, we see more thyroid disease in women. This is one more reason for that. But we really see thyroid disease become unmasked or prominent when women go through changes in ovarian function. So during menarche, when they get their first menstrual cycles, during pregnancy or after pregnancy, during perimenopause, during the menopausal change, those are times that it's really common to see thyroid disease start to manifest and show up. And there are often times in life that are times you're having symptoms anyway. You know, pregnancy is a tough thing, and afterwards you've got a young baby, and you expect to be tired, and you don't always think that there's a medical reason for it. You know, during menopause, women can be having hot flashes and having other disturbances, and thyroid disease can show up, and they may not realize that it's also the culprit for some things. This affects brain cells. We mentioned that briefly with the cretinism. It also affects intestinal peristalsis, which is the normal movement rate of the intestinal tract. So overall, it affects just about everything. You know, literally every cell in the body from head to toe, its key functions are impacted by the presence, the absence, or the fluctuations of thyroid hormones. So it's one of the most central governing aspects of our health. So we're seeing more thyroid disease, thyroid cancers, hypothyroidism, Graves' disease. You know, why does the gland go wrong? Well, that frog with all those eyes, that's a horrible, horrible picture. That's why we get thyroid disease, because we've got a lot of things in our world that our bodies have not biologically adapted to process very well. Now, the thyroid is kind of unique in that it's even more sensitive to toxins than other parts of the body are, the same way that frogs can be more sensitive than other larger animals are. Your thyroid, many of you may know, has a need for iodine, and it's kind of a puzzling thing. There's a lot of odd little mysteries or unique elements of thyroid health and thyroid metabolism, and this is just one of many. Any mineral you could think of probably has dozens, if not hundreds, of jobs that it does in your body. You know, magnesium, according to Alan Gaby, has upwards of several hundred. And the same can be said for calcium and zinc and many other the real big key minerals like that. Now, iodine has one role to play in the body, just one, and that's the formation of thyroid hormones. There are a few other parts in the body that you may find it in, but it's not known to have any relevant purposes there. Now, the amounts of iodine that we're exposed to in the world are not adequate for production of thyroid hormones. The concentration would be far too low if it just diffused from the blood into the thyroid. So consequently, our thyroids have a pump. They have a mechanism, and it's called the sodium iodide transport mechanism. And basically, it identifies iodine, and it pulls iodine inside the thyroid for the purposes of forming thyroid hormone. And it pulls it in against a very high gradient. You know, you can have 100 times as much iodine inside your thyroid as you've got in your blood because of this pump. So far so good. The pump's a good thing. We need that. It makes up for our iodine intake. But the problem is that there's a big host of modern chemicals that we're exposed to that are vaguely enough like iodine where they get transported up inside that pump along with the iodine. So that's the problem. These chemicals build up inside the gland, and some people have more selective pumps than others. Those whose pumps are less selective are more prone to build up waste inside their thyroid. That's the genetic susceptibility part of this equation. And thyroid disease does have a strong tendency to show up among family members. Now, that doesn't mean that it can't show up when there's not a family history. You know, I just saw someone a couple of weeks ago where very young, very healthy man, mid-20s, absolute zero family history of thyroid disease, but it really struck him hard and abruptly and caused pretty big health crises. And it took quite a while to get diagnosed because doctors were not suspecting that, given his age and gender and lack of history. But sure enough, we saw it, it was apparent, and even I remarked that this is a little less common, so we did some more detailed work to assess his toxic load, and sure enough, he had rather unusual mercury exposure, and that was probably the main trigger for it. So some families have more significant susceptibility, and in those cases, it may not take as much toxic exposure. You know, they wouldn't necessarily have had a lot of junk in their bodies, but the small amount of junk that none of us can totally avoid is more apt to build up in people that have that type of susceptibility. Now, that's the first two steps. You've got some susceptibility plus exposure to toxins, or you've got minimal susceptibility plus a very high exposure to toxins, and then there's usually some triggering event. So imagine that your thyroid has all this junk inside of it, and that could be mercury, it could be perchlorate, which comes from the soil in some areas, it could be lead, it could be fluoride, which is in municipal water in quite a few areas. But there's some bioaccumulation of wastes, and they've been brought inside the gland via the sodium iodide transport pump, which is designed to bring in iodine. And these wastes have built up, and they're creating a bit of free radical damage. They're basically like some smoldering coals rolling around in your thyroid, irritating everything. So that's setting the stage, and then there's usually some acute illness. And that could be something as common and routine as a bladder infection for a woman, or a routine cold or a flu or something, or bronchitis. But there's something going on that gets a whole lot of antibodies formed against things that are entering your system. And during that process, the formation of new antibodies starts to occur against this smoldering, irritated thyroid gland. The proteins inside the thyroid, or the proteins that are outside your thyroid, they can become mistakenly attacked because the whole gland is irritated from these toxins. And once you get these three steps together, the susceptibility, which could be great or small, plus the toxins, which could be great or small, depending upon the susceptibility, and then some kind of an acute illness, then bang, you've got autoimmune thyroid disease. And we also call this ATD. And almost all thyroid issues start out that way, regardless of whether they're hypo or hyper. And it's funny because the difference between the two on a molecular basis are very, very microscopic, very, very tiny. There's some proteins outside the gland that tell the gland to work, and some proteins inside the gland that help the gland form hormones. And if you attack those external proteins, your gland is getting told to work all the time, even when your body doesn't want it to. And that's how Graves' disease starts. But if you attack the internal proteins that are part of the thyroid factory, how we actually make the hormones, then the gland gets destroyed and the factory gets damaged and it can't form adequate hormone. And over time it makes less and less. And that's Hashimoto's disease. So the two of those, the hypo and the hyper, oddly enough, have a very, very similar means of onset. Very similar mechanisms cause them. And based upon factors that we're still working out, it can go one way or the other. Now, the underactive disease is about 10 times more common. It's much more prevalent. But the overactive does happen as well, and the mechanisms are the same. So as a naturopathic physician, it's great because I've got a bit of a bigger toolkit to manage this. And because of that, a lot of folks that have had thyroid disease and still are suffering, which is, again, at least half of those who already know they have it, we can help them get better when simple treatments they were on before were not adequate for them. And how this is all done is really just by using an understanding of the core naturopathic principles and also a detailed understanding of the mechanism of onset of thyroid disease. And the first step is we want to properly detoxify the body. We mentioned how toxins being present are a big part of the disease starting. So unfortunately for most people, the detoxification doesn't reverse the autoimmune process. Their body still will keep attacking the gland. But having those wastes out helps the body do a much better job utilizing the hormones that the body is making or that you're taking if there's too few that are being made. And there's technology available that allows us to understand not just how much waste someone's been exposed to in the recent past, but how much waste had actually built up deep in the body's tissues, in places like the thyroid, in places like the brain. And once we know what types and what amounts of waste we're dealing with, we can then do custom protocols for each person to take those particular wastes out. And that makes things much more effective for their symptoms clearing up. In many cases, their symptoms are, of course, from the thyroid not working right, but they can also be other ways in which these wastes are affecting them negatively. These things, even if they don't impact the thyroid, they can negatively affect the brain, the nerves, the muscles, the kidneys. So once we see what built up to trigger the thyroid issues, taking that out makes the body work better in lots of ways. And that's one really beautiful concept that's unique to naturopathic medicine versus conventional medicine, is that we understand in this healing power of nature and this inherent wisdom of the body. And it's not like you've got to get the ball and carry it all the way across the field for the touchdown. You've just got to get the ball moving in the right direction, and the body can do so much more from there. You know, once you start doing things that allow for more vitality, more vital force within the body, then it can take over and it can start using all of its amazing wisdom to regain homeostasis. Oftentimes it just needs a little bit of a push, a little bit of coax in the right direction, or the removal of something that was keeping it from going in the right direction. But we have this amazing system that's really set up to work properly and heal and recover. So it's oftentimes just getting the ball rolling in that. Now the immune system is a big part of this too, and that's an element that unfortunately is very, very underappreciated in mainstream endocrinology, is that thyroid disease is first and foremost an immune disease. So part of helping people feel better is really identifying what else is happening with their immune systems. You know, what stressed the immune system, allowing it to attack the thyroid, and what of those factors are still present. Some of the more common elements there can be other types of allergies or ongoing low-grade infections. So the immune system, basically you've got some cells that identify things as foreign and then intentionally attack those. And the problem is that if you're making a mistake, if those cells make a mistake, they can attack things that really aren't foreign and really aren't dangerous. And that can apply both to things that we ingest and also things that we have naturally circulating inside of our bodies. So when we're attacking substances from outside of us that are not dangerous, that's what we call an allergy. You know, there's some pollen, there's some mold that we breathe in, and a certain percentage of us, we will feel like we're sick because our immune systems think that those molecules are harboring some dangerous organism that could hurt us. And they're really not, but try telling your immune system that. It triggers a big variety of symptoms. So that's what an allergy is. And an autoimmune disease is basically the same process, but you're attacking something that belongs inside of your body, like in this case, proteins that help synthesize thyroid hormones. So the more of these incorrect reactions you have going on, the more likely you are to have other incorrect reactions going on. And also, the worse any particular incorrect reaction becomes. So if someone has reactions to a common dietary element, like perhaps dairy foods, and they're consuming that on a regular basis, that will alter the immune system in a way to make them have a more aggressive attack against their thyroid, and consequently make it harder to really correct and take care of their thyroid symptoms and achieve ideal levels. So the more things stressing the immune system that can be identified and avoided or desensitized or treated in the case of chronic infections, then the less the immune response is and the easier time that there will be in making up for all these symptoms. So another big step that we can do that is not done conventionally is really correcting all three hormones. And this one really brings to light some of the problems that we have going on in medicine right now. You know, I'll mention later on that medicine is really not evidence-based today. It's really drug-based. It's not a matter of what is the most effective solution or remedy for a condition. It's a matter of what is the most effective new marketed drug available for the condition. And that's not always the best solution. So case in point, somewhere around 1979, prior to then, doctors used natural thyroid for at least 60% of their patients. The synthetic thyroid medications were not favored and not used that widely. There was a situation in 1979 in which a manufacturer using very poor quality control techniques had some doses of natural thyroid that had too little hormone in them. And there was a case report written up in JAMA about a woman who is obviously very symptomatic, obviously suffering from bad hypothyroid symptoms, even though she was on treatment. And the reason for it turned out to be that her medicine was not properly made. It didn't have the expected amount of active hormone. And there really wasn't aggressive technology used in assaying how much hormone was in the thyroid, both the natural type or the synthetic type, up until that point. And the manufacturers of synthetic thyroid used that as a strong marketing tool to argue against using the older products and towards using their newer synthetic products. And over the next several years, they very effectively swayed medical opinion to their side. And even though the methods of assaying thyroid hormone completely changed after 1980 and allowed for very accurate monitoring and very quality controlled guidelines for natural thyroid, it shifted to where now less than 1% of mainstream endocrinologists will use desiccated thyroid in their practices. And the sad thing is that it was not a matter of efficacy. It was not a matter of the synthetic drugs being superior. It was very localized to a quality control issue by one rather obscure manufacturer who went by the wayside right afterwards. So market forces had a larger impact upon the choice of practice in medicine than the patient outcome did. And there still has been some debates in medicine about whether or not the other thyroid hormones that are found in natural thyroid are helpful or not. And probably one of the last big papers that was done on this topic, and probably one of the last ones that will be done, really illustrated the shortcoming of medicine in that we put too much focus upon medical findings, objective laboratory findings, and too little focus upon patient outcomes. They had a study done in which patients took natural thyroid or synthetic thyroid and actually switched back and forth a couple times. And no one knew which one they were taking when, but they were given questionnaires that measured their alertness, their mental acuity, and they were also asked which pill they preferred, like the red one or the blue one, and they didn't know which pill was which. They were also tested. They had thyroid blood levels tested frequently during this time. And since the doses that were used of both medicines were pretty similar overall, the thyroid blood levels were similar, and anyone with any rationality would expect that. However, their questionnaires about their preference, 96% expressed a preference towards the desiccated thyroid, not knowing that it was a different medicine. And there was also clear differences in their scores in terms of their energy levels and their cognitive abilities. But the medical researchers looked at all this and they said, oh, the blood tests were all the same. Why would we use this other type of thyroid when the blood tests were the same? And so many failed to see that the patients clearly expressed a difference and clearly had performance benefits. But the editorials about the study all said, look, it was the same blood levels, why would we use the other medicine? And I just shake my head and can't even believe that that was the interpretation from the study. But that's kind of where things are. The mainstream world only uses one thyroid hormone, and that's T4. The body has 3 active thyroid hormones, possibly more, but definitely 3, and that's T4, T3, and T2. And of them, T4, the one that we give in mainstream medicine, has the least biological activity. It depends upon mechanisms to convert it into the more active hormones, the T3 and the T2. And as you could imagine, people with thyroid disease often have poor thyroid conversion mechanisms. So they often lack the capacity to generate adequate T3 and T2 out of T4-only medicines. So one big thing that we can offer is correcting all of those properly. We also look at all the other glands. The same way we think about the body as being a large interconnected whole between body, mind, and spirit, on a smaller scale, the thyroid is part of the interconnected whole of the endocrine system. And when one gland has been altered, the other glands have had to compensate, and that can often leave them in a state to where they have decompensated. They've had to work harder for somebody else on their team being lazy, and now they're tired. So we can very commonly see adrenal dysfunction or early ovarian dysfunction or changes in testicular output in someone that has struggled with thyroid disease. And of course, they will not achieve their full wellness potential until those other issues have been properly identified and resolved. The last point that we do, and it's a funny thing because a lot of what a good naturopathic doctor can do, any good doctor should do. It's not always something that's alternative or holistic or granola. It's just being thorough and doing a good job and thinking outside the box a little bit. The structure of the thyroid is a huge problem. I mentioned before that the fastest increasing type of cancer in North America is thyroid cancer. Upwards of half the population, the adult population, may have thyroid nodules, may have thyroid abnormalities. And of course, that's more common in those that have thyroid disease, and the nodules are more apt to progress to cancer. So we want to make sure via exam, via ultrasound, that there is nothing abnormal lurking in the thyroid. And we also want to use the most evidence-based current treatment strategies in terms of dosing to prevent any issues like that from forming or growing. So part of what we can do as naturopathic doctors is to really help manage the structure as well, thinking about the person's overall needs and their long-term health. So yeah, this is a great, thyroid disease is a very good metaphor about what we can do as naturopaths that's above and beyond what conventional medicine offers. And part of it is that this really is a calling right now. You know, we are at this very, very dramatic crisis state in human history that's just unprecedented. A few years ago, Colorado was in the news for having the lowest rate of obesity in the nation, and they were applauded for that. It was said, hey, you know, look at this. What can we learn from this for the other states? You know, they're outside, they're active people there. You know, what's culturally different? What can we get from this? And about a decade ago, there was a story I read about another state, Alabama, being in the news for having the highest rate of obesity. And the story was, boy, what can we learn from them? Is it heavy southern food? Is it the sedentary urban lifestyle? You know, what is it that we can avoid by their negative example? So here's the thing that just completely amazes me. Alabama hitting the news roughly a decade ago was at 15% obesity. Now, a little over a year ago, Colorado being in the news, lowest rate of obesity in America, they are at 15% obesity. So within barely more than a decade, what was once the highest rate is now the lowest rate. So these last couple decades, the rate of obesity and the complications of it have been just skyrocketing into unprecedented levels. And the effects this is having on our health are just catastrophic. You know, for the first time ever, we predict that in the year 2012, more humans will die from disease of lifestyle, basically obesity, diabetes, cardiovascular disease, many types of cancer. More will die from this than will die from starvation and infection and malnutrition. That's never happened before. Also, we're now projecting that the lifespans for the coming generations are likely to be shorter than they are of the current generations. You know, we've had so many great stories about the advancements of medicine, mostly through managing infection and managing hygiene, that extended the lifespan. And now it's going the exact opposite way. You know, very commonly, the ER doctors know that teenagers can get strokes. They know that's no longer an unusual thing. And we know that elementary school kids suffer from fatty liver disease. That's a huge problem that you don't hear much about, but may be impacting upwards of 20-30% of the adult population at early stages. So it's just huge, and it's hard to exaggerate the scope and the severity of this and how many trillions of dollars of expense we can be facing in terms of this mountain of diabetes, as some have called it. And the tough part is that conventional medicine really does not have solutions for these problems. You know, the approach that they have really came out of battlefield medicine, and it came out of the success of the model of the germ theory, which is a real thing. You know, if you find the right antibiotic, you can kill an infection. And of course, we're now seeing limitations to where antibiotics have been overused and infections are getting more aggressive. But that mindset really created the whole modern medical enterprise. It was thought that the right pill could cure any ill, and in so many instances, it really does not work. And right now, we're spending most of our healthcare expenses on pills to manage diseases of lifestyle, and it's the most ineffective strategy. It just blows my mind. There's a concept in medical research called the NNT, and that's basically number needed to treat. It's how many times you have to do something to see that it actually worked. And you would think it would be once. You know, an effective treatment, you should do it and it should work. One of the more effective things we have in conventional medicine, for example, is the treatment of H. pylori-caused ulcers. And if you treat 11 people with antibiotics properly for these particular types of ulcers, about 10 of them will recover. So the NNT is 1.1. You have to treat 1.1 person to see one success, you know, pretty close to perfect. And that's what most people think medical treatments do. But the difficulty is that drugs that treat diseases of lifestyle, such as drugs for cholesterol, their effect upon actual health outcome is so ridiculously small, I don't think doctors have a sense of just how weak they are. So oftentimes, people are given a drug, say, for their cholesterol, and they think that it's a hall pass. They think that, The drug means they're safe. It means they're safe from heart disease. And consequently, they don't have to feel pressure to undergo lifestyle change or dietary change because now they're on a drug and they're safe. But the drug is actually not a hall pass. The drug is a lottery ticket. And what I mean by that is, if you take women, for example, that haven't had heart attacks, they've got high cholesterol, if you treat 300 women for roughly 5 years, you'll see one less death in that group treated. And that's only if you ignore the fact that at least 15% will drop out because of catastrophic side effects. So and there's also not a benefit in total mortality. So the benefits that these treatments have are ridiculously infinitesimal. They're not hall passes, they're lottery tickets. And meanwhile, people think they've got a hall pass and they're not going to try to take care of themselves. They're not going to do the things that actually matter. So what are these things really cured by? Well, we know what they're cured by. It does take proper application and skillful leveraging of the tools, but it's really diet, exercise, nutrients, mind-body medicine. These are the things that cure diseases of lifestyle, and that's what's really killing us today. It's no longer the things that conventional medicine is good at. Those things are around, but they're pretty well taken care of. We've got good models in place for that. And what are ND's authorities on? Well, we're authorities on diet, exercise, nutrients, herbal medicines, mind-body medicine. We are the ones that have the tools to make a difference on the globe right now. And thankfully, more and more in medicine are seeking these things out, and more groups are realizing the power of these. And this is where we've been at since day one. This is where our profession originated hundreds of years ago in Europe. This has been our central focus all along, and we are the authorities and we are the experts in these areas. So why naturopathic medicine? Well, it's evidence-based and not drug-based. You know, we're not to figure out what's the best drug. We're out to figure out what's the best treatment. You know, we've got the broadest training. We learn everything the conventional doctors learn. They have no tricks that we don't know. But we have a whole lot of tricks they don't know. Our training is much more comprehensive. Our growth potential, right now the sky's the limit. There's so much need for what we have throughout the world, and really so few of us out there. It's a perfect time for that. And if you're on a path of wellness, it's great because really you should be your own best advocate. You should really be living this, and you can do that. You can get yourself healthier as you're helping other people get there as well. So why SCNM? You know, I was in the very first class. I've seen the school go through so many wonderful changes and growth steps over the years, and I'm so proud to be an alumni from them. This is the only school that does clinical training on day one. You know, there has been just mountains of data about how adults learn, how people learn things properly, and that data pretty much gets ignored in all of our educational systems. And SCNM is not ignoring all this data on adult learning. They've actually incorporated steps to where right from the beginning, you're hands-on with patients. You're seeing what's going on with people's lives. And what you're learning in the classroom has a direct way to correlate and a direct memory to attach itself to. You're not just sitting in a class for years on end memorizing a whole lot of junk, forgetting why you're even there. You're right away engaging all aspects of your brain. It's a completely different curriculum that's unique, and it's obvious. This should be how it's been done in all medical schools all along. The other thing I really love about SCNM is the fact that Dr. Mittman's heading it up. You know, he's out there working so hard to place alums and get them in good situations, and he's passionate about a profession, and he totally lives this lifestyle. You know, he's incredibly fit, he's an amazing cyclist, and he works hard in terms of getting his diet dialed in for what his body's needs are, so he's just a walking model of this, and he lives it firsthand. And that's really what it takes to do this well. You've got to be completely passionate and completely engaged and not just doing this from the side. And he's an example of that we can all really be inspired from. A couple of things I wanted to point out. Those of you that do go into medical school, you've got to take care of yourself. This is the most critical time for that. All too often, people put their studies on the front burner and their health on the back burner. And then afterwards, they keep those same bad habits for the rest of their practices. So in medical school, you want to practice what you're preaching and what you're learning right from the get-go. And here's a few basic steps for that. Stay off of sugar. Sugar is poison. There's a wonderful video called The Bitter Truth. I would encourage you all to watch that. It's on YouTube. Sugar is literally poison. You want to eat properly. You can do some great meal assembly, batch cooking techniques to save time and save money on this. You want to exercise. You can do this in very strategic ways that don't take a ton of your time. You've got to get enough sleep. And to do that, you really don't want to use caffeine on a regular basis. done on a daily basis, your quality of sleep goes down by at least 1 hour of good, refreshing sleep per night. And you can actually study better and perform better when you're not using it on a daily basis. So a couple little tricks and you can do a whole lot better through school. And we've left some time for Q&A here. Let me modify the screen so I can see this properly. And we'll open up for a few questions.
Thank you, Dr. Christianson. That was some great information. We will now open the floor for questions, as well as address those questions that were submitted beforehand via our website. You can always request information from me at j.durham@scnm.edu. So with that, let's go ahead and get into the questions that you have regarding thyroid disease. I do have quite a few that came over in the last couple minutes. Let me go my first one. What percentage of thyroid autoimmunity is due to gluten sensitivity, Dr. Christianson?
You know, that's an awesome question, and part of what I do is to really make sense of not just corralling the conventional model, but corralling the alternative model. There's been a really big excitement about gluten being the big cause of our bad health over these last few years. And I think it's great that we take a close look at our diets. I think it's great that we cut out processed starch in general. So gluten is certainly a huge factor for those that have celiac disease. And celiac disease is more common for those that have thyroid disease. The rates of such are roughly this. It's about 1% of the population in general, and between 3 to 5% of those that have thyroid disease. And there's been clear data saying that if you have celiac and you have thyroid disease, the consumption of gluten will raise your antibody output and consequently make your disease harder to manage. So there definitely is a milder type of gluten intolerance that we're still sorting out, but it is well established as a real phenomena, and that's much more common in celiac. Some have argued perhaps 10 to 20% of the population. The gluten intolerance doesn't have a direct immunologic effect upon the thyroid the way that celiac does. So for some people with thyroid disease, 3 to 5%, gluten can have a direct immunologic assault on their thyroid, and they just really have to cut it out. For a larger percent of people, with or without thyroid disease, gluten may give them digestive symptoms, may make it harder to manage their body weight, and in general, most of us are a lot healthier by cutting out refined carbohydrates. So a lot of folks may cut gluten out of their diet and improve their health, even if they don't have a specific gluten problem. Now, the pitfall that I see some make is they focus on one aspect of the diet and miss the big picture of their diet. So I've seen many that have thyroid disease that eat total sugar junk food, but gluten-free junk food, and feel that they're doing themselves a service. They're really not. So that's the tie-in with gluten and thyroid. It's not the cause of thyroid disease, but if you have celiac and thyroid disease, it will worsen the immune component.
Great. Thank you, Dr. Christianson. My next question, which is better, Armour or Naturopathic? What makes the difference?
That's an awesome question. So here's the story. There's a place called American Laboratory, Inc., and that's a large ranch with a whole lot of pigs. So a 300-pound pig, their thyroid is not the same size ratio that it is for humans. Their thyroids are smaller than ours. So a 300-pound pig, their thyroid's not much bigger than the end of your thumb. If you've got skilled anatomical dissection techniques, you can isolate that thyroid, and that's taken, and there's federal guidelines on how it's processed, how it's freeze-dried, and it's made into a thing called USP desiccated thyroid powder. Now, USP desiccated thyroid powder has 4 possible fates right now. One fate is that it can be bought just as it is by a compounding pharmacy and placed into tablets or capsules and then given per a set dosage. The 3 other fates are that it can be tableted by one of the current 3 manufacturers. We have NP Thyroid, which is the newcomer on the market. They've been out for just a little less than a year. And then we have Naturopathic, which is made by RLC Labs, and we have Armour Thyroid, which is made by Forest Labs. Now, it's all the same powder. All those things are the same powder from the same raw material from the same manufacturer. So the difference comes down to quality control. There are USP guidelines that also dictate what happens after that powder is tableted by one of the big manufacturers. Now, the bad thing about compounding thyroid is that there are no guidelines or stipulations for quality control. So the powder, as it comes from the manufacturer, is assayed to have a certain amount of iodine, 0.2% iodine by weight. And that gives you a ballpark range of hormones, but not a perfect range of hormones. So after tableting, there's guidelines that dictate what the allowable range of T4 and T3 is. And many of us argue that the allowable range is actually a bit broad. You could have 10% variance on one or two hormones and still have that be an acceptable product. So consequently, you could have one batch 20% higher than the next batch. And given that T3 is much more potent, that can mean one pill could be a lot more powerful than the next on an acceptable product. The manufacturers of NP Thyroid and Armour Thyroid, they do adhere to the federal guidelines like they must. The manufacturers of Naturopathic adhere to the guidelines, and above that, they allow for only a 1% variance on either hormone, so a total variance of no more than 2% for the amount of T3 and T4. So it's the same raw material, but there's voluntary, tighter in-house quality control measures in place. And I personally see that in my practice. I have patients that, if they're not on Naturopathic, but they're on a different brand of desiccated thyroid, it does just take more testing and more adjustments. And I tell people that. So I say, well, if you want to have less testing and stay stable, let's just have you on this particular brand instead. And there's no cost disadvantages, and there's no other disadvantages with it. So that's my preference.
Great, great. My next question, what would you recommend for someone who has hyperthyroidism and having a hard time losing weight?
Well, this is a funny thing. We have this idea that, and I could have created this idea as well for my talk, that low thyroid means weight gain, and it would seem intuitive to think that, wow, hey, maybe if my thyroid was a little higher or maybe even overactive, I would really lose weight. And the sad thing is that really doesn't happen. Something that makes thyroid disease difficult for a lot of doctors and patients to grasp is that you can see these very common lists of symptoms of hypo and hyper. In reality, you can interchange those symptoms. If your body has a little bit too much thyroid hormone, then you work really hard to dump thyroid hormone. Your intestinal tract, your liver, your gut flora, all these things act in ways to speed the elimination of thyroid hormone. And consequently, you can have hypothyroid complications, such as weight gain issues. And very often, people that have hypothyroidism, their doctors think that if they dose them just a little higher than they really should, that might make things better in terms of their weight or their energy. And it doesn't. It actually makes things worse. So with hyperthyroidism, yes, people can have that and have weight issues. And sometimes that can be because of the thyroid, or sometimes it can be a separate problem. But in any case, the strategy is like it is with hypothyroidism, just achieving the normal amount, the ideal amount of thyroid. And hyperthyroidism, I did write about this in the book, there's basically three treatment directions. There's using drugs or pills to slow the thyroid, there's radioablation, and there's surgery. Surgery is not used that much for this condition. Radioablation, many argue, is very overused in the United States, much more than it is in the rest of the world. There are some pretty safe ways, sometimes with pharmaceuticals, sometimes with natural compounds, or sometimes some combination, that can slow the thyroid without long-term procedures that have risks. But it does take doing that in the right method to get the gland slowed, but not excessively slowed. And the most common cause of hyperthyroidism is Graves' disease, and about 75% of those that have Graves, the condition will spontaneously self-correct within 1.5 to 2 years. So if you can properly manage the levels via nutrients, drugs, some combination of those, then it often does correct itself, and the person often is stable afterwards. But to manage body weight for hyperthyroidism is first off to correct the thyroid levels.
Great, great. My next question, do you dose thyroid at bedtime, as recent studies showed work better for patients?
Yeah, I saw those studies myself. They did not show that it worked better, but they did show it was equally effective. And I do tell people that's a viable option. The main thing about thyroid hormones is that their physical mass, just like I talked about how if you could put your thyroid hormone in the palm of your hand, it would be microscopic. It's the same way when you're taking a thyroid hormone. The actual physical mass of the active hormones is pretty dang small, and a big long list of proteins, fibers, minerals can make those active little peptides not absorb properly. So the most critical thing is about taking it away from food. The next critical step is trying to mimic your body's diurnal rhythms. Most thyroid secretion takes place in the wee hours of the morning. So the closest approximation of that would be nighttime or morning time. And both are equally effective. The issue about nighttime is that you really want to be going to bed on an empty stomach, definitely 2 to 3 hours after you've had any food. And for some people, that's fine for them. They want to wake up, roll out of bed, have some food, have some tea, start their day promptly with putting something in their mouth. And in those cases, nighttime is an option. The majority of patients, when I present this to them, do opt to take it in the morning, and the protocol there is roll out of bed, take it with a glass of water. Usually right after taking it, you can use the bathroom, brush your teeth, take a shower, and that's often half an hour. It doesn't take very long for the thyroid tab to move through your stomach. So I tell people half an hour is inadequate because I don't want them to wait longer and then not have breakfast, get out the door and not have a good proper breakfast. So yeah, half an hour after taking it, you can have food. You only take it with water. Nighttime or morning are both completely equally effective, not an advantage of one over the other. The majority of folks prefer morning. Both ways are fine though.
Great. I'm going to be able to take a couple more questions because we're running out of time, and I know everybody's busy. My next question, Dr. Christianson, I had a bout of thyroiditis that presented as hyperthyroid about 4 years ago. While it seemed to have completely resolved, does this mean I could be more susceptible to thyroid disease in the future?
It does, and there's different types of thyroiditis. The majority of them can stabilize. There's some like subacute thyroiditis, which is one of the more common. And most folks who get that, they can self-correct and they can stay stable, but there is about a 30% rate of future thyroid disease. So yeah, it often does reset, and it doesn't mean you're definitely going to have thyroid problems, but certainly keep an eye out on your symptoms and your health and your thyroid scores too. I would watch those regularly. And also think about family members. There's still a higher risk for family members because of that.
Great. One more question. How does sugar alcohol affect the thyroid?
Sugar, alcohol, or sugar alcohol is one word?
Sugar alcohol is one word.
It does not affect the thyroid. Sugar alcohols include mannitol, sorbitol, xylitol. They're commonly used as sweeteners. Debating on how you classify that, they could be classified as natural or artificial substances. They are substances that are not absorbed across the intestinal lining. So basically, you swallow them and you poop them. And if you eat a lot of them, you're going to get loose stools. But because they don't cross the intestinal lining in any high degree, they don't interact with your body's inner workings. They don't go into your bloodstream. So they have no direct impact upon thyroid function. You could certainly make a case that you wouldn't want to consume them with your thyroid pill if you were on thyroid replacement because, of course, they can make you not absorb that. But they don't actually enter into your thyroid by any chemical way because they don't enter into your body by any means.
Great. Okay, at this time we're going to move on. There are some questions that I was not able to get to, and I will do my best to get back with those of you that we did not answer, whether myself or Dr. Christianson, or we will definitely get an email out to you. At this time, this is the admissions process, so these are the prerequisites that we need in order to, if you're interested in applying to SCNM. So we do our application now through ND, which is a centralized application service. So that service is actually will be brought back up on September 4th. So it is down right now for maintenance and starting the new year. So that will be ready to go again on September 4th. But of course, letters of recommendation, your essay is done right there online, transcripts from all colleges that you attended for your bachelor's degree, and then the completion of prerequisite coursework. So again, like I said, quite a few of you, I was not able to get to your questions. This was a great webinar. I know it's a great topic. My daughter actually has thyroid disease, so I can definitely relate. And she is 20. She is 20. So, and I can definitely relate, and I've read Dr. Christianson's book. It was a great resource, and this was a great webinar for me to even host. So, So at this time, if you have any other questions, remember I gave you my email address, and it is j.durham@scnm.edu. Please feel free to drop me an email, and whether it's me or Dr. Christianson, one of us will get your question answered, I promise.